us by video link as well. We'll have time for questions afterward, but we'll ask you to keep it pretty short as it's a House day. So I'll ask Minister Copping to begin.
Great. Well, thanks so much for joining us, and good afternoon, everyone. I'm happy today to outline more action to implement the new agreement between the Government of Alberta and the Alberta Medical Association. Family physicians are vital to the communities they serve and to our health system overall. But many of them, especially in underserved areas, are facing inflationary pressures that are putting their practices at risk. Too often, we hear about doctors having to leave their communities and move to a larger centre just to make ends meet. Like other Albertans, they're feeling the pinch to pay for wages, supplies, and literally keeping the lights on in their clinics. Now, the investments we're talking about today will give doctors stable, predictable funding so they can focus on providing high-quality health care. The first way we're doing this is by increasing the amount physicians receive through the Business Costs Program. The program provides an extra payment to physicians in addition to the basic rate they receive for providing specific services. This helps ease physicians' costs in office-based practices, particularly for family physicians and specialists who face greater impacts from rising business costs. The rate increase is expected to cost an additional $20 million a year over the 4-year term of the new agreement. This is in addition to about $80 million that we already spend on this program each year. So it's roughly a 25% increase in the total value of the program. For an individual doctor, the payment rate will increase from $2.95 to $3.59 for eligible patient services provided in a physician's office or a diagnostic facility. On average, it will mean an extra $2,300 for each physician annually. And the change will be retroactive to April 1st, 2022. Increasing the program rate will help keep office-based practices where they're needed the most. And along with this rate adjustment, we'll be working with the AMA to conduct a review of the program over the next 2 years to modernize it. We're also improving other physician support programs. The deductible for all physicians through the Medical Liability Reimbursement Program will be reinstated and will be a flat $1,000 in 2022. The program provides partial reimbursement to eligible physicians for medical liability protection fees. These fees are set annually by the Canadian Medical Protective Association and vary depending on the type of work a physician does. The decrease in the deductible will apply to about 5,000 urban specialists. It won't apply to family physicians or rural physicians because they already pay the $1,000 deductible amount. Physicians who were reimbursed for 2022 based on the higher deductible will receive an additional reimbursement from Alberta Health. Decreasing the deductible means government pays a larger share of the fee. That represents roughly another $9 million that government will pay instead of physicians. Changes are also being made to the continuing medical education program for physicians. This program supports professional development by reimbursing physicians for the cost of continuous professional development. The program ended in 2020, and now we're bringing it back. The program is now open retroactively for 2021-22. For the current year, we're also increasing the reimbursable amount from $2,100 to $2,200 for each eligible physician. These changes will help strengthen Alberta's healthcare system. They will address inflationary pressures that physicians are facing and help practices stay in communities where they're needed the most. They're also part of our larger commitment to the principles that are the foundation of a new agreement with the AMA. The agreement is more than just about money. It's about the kind of relationship that we want with physicians. It's a partnership based on trust and collaboration. And this is one more step in building it, and I look forward to more. Once again, I want to thank Dr. Rinaldi for her part in carrying this partnership forward, and thank all of our physicians, especially those in family practices, for the work that they do helping Alberta patients each and every day. Now, thanks again for coming this afternoon, and now I'll ask Dr. Rinaldi, President of the AMA, to say a few words. Dr. Rinaldi.
Thank you, Minister, and thank you for those who've attended today. So there are many components to the new agreement between the AMA and government. We've made several announcements already since physicians ratified the agreement, and there will be more to come as we work together on implementation. I hope the public sees these announcements as a sign of collaboration to improve the healthcare system and to help to ensure that they get the care they need. In its current state and with so much pressure on the system, it is going to take some time to make these improvements. There are other things that can be done in the shorter term that will help, but there is a long road ahead to stabilize physician practices, build up primary care in the community, reduce the strain on hospital systems, and provide access to the care that patients need. I'm certain that these objectives are shared with the Minister, and we look forward to working together to progress in these directions. So with respect to the business cost program, steeply rising business costs are a major challenge for physicians who need to maintain their offices and cover expenses such as staff, billing services, accounting, rent, utilities, office supplies, medical equipment, office maintenance, improvements, offices, licensure, insurance, etc. Anybody who has a small business would be well aware of this. Business costs were a priority for the AMA in reaching this new agreement. We need to remember that as we move forward, we need to support not only the viability of current physician practices, but we also need to be able to retain those physicians in practice and recruit other physicians to Alberta. We look forward to ongoing evaluation of the effects of the program and all the other supports for physicians that are in the agreement that we have dealt with in collaboration with government. I do appreciate this expression of support for physician practices that the business cost program does provide. Thank you.
Thanks, Dr. Rinaldi and Minister. We've got reporters in the room and I think at least one on the line, so we'll start in the room, please.
Arthur Green, Western Standard. Minister, how does this new agreement strengthen the province's relationship with doctors?
It does it in a number of ways. I guess the first thing is about partnership. First we got an agreement, and the key component and core of this is about partnership. So we have a working committee, like the management committee, and that management committee will help us implement the issues in the agreement, or implement the items that we've agreed to in the agreement, and make sure that we get it right and we agree on, the agreement is done at a higher level. So how do we actually implement it to make it right? It also provides us an opportunity to address jointly a number of the issues that have been raised. Plus, as we move through the agreement and we look at what's going on in the healthcare system, it provides us an opportunity to work together to talk about those issues and solve them. So, that was a cornerstone partnership of this agreement. The other way that also helps is about stability, right? Having an agreement so that doctors know what their source of revenue is, and can project it in the future, significantly helps. Do we make an investment in more practice? How do we expand that? What do the economics look like? Because we take a look. These are small businesses, right? So they need to understand what their revenue source is. So just having an agreement over a 4-year period, so they know what that looks like, and then a commitment to work together to address the issues. I think those are the big components from my perspective. But I don't know, Dr. Rinaldi, if you wanted to comment further on that.
No, I mean, I think that's a huge issue. Certainly for community practice, small business physicians need to know what their revenue source is. You said it correctly. I think for physicians who are looking at opportunities to practice in different parts of the country are hesitant to come somewhere where they know either they don't have a predictable income source or they don't have a predictable resource source to practice to their level of skills. So it's very difficult to get the subspecialist neurosurgeon in here if we don't even do that procedure in Alberta. So all those things, having a voice by a formal agreement, can only improve things. Before that, when we had no agreement, we sort of had nowhere to go and it was just drifting.
Just as a follow-up, what have the other doctors said about the agreement? Like, will you see an influx of doctors moving to Alberta because of this, or what will it change?
Yeah, so there is stability with this, so doctors can actually take a look at, okay, if we come to Alberta, and I want to set up a practice, what is my revenue source is going to look like? There is a challenge, quite frankly, across the country in terms of shortage of healthcare professionals. Doctors are one of them. But this this agreement will maintain Alberta as providing revenues to doctors among the highest paid in the entire country. And the other piece of it, and I'll just touch upon, is the innovation piece, because that's the other cornerstone of this agreement, and it provides a process for us to work together. And how do we improve different models of compensation? Because it's not one size fits all. We have predominantly a fee-for-service model in Alberta, but we know that some doctors, don't want that. They want other types of models. So we, looking at different models, and then how can we actually put in performance-based metrics, and sharing the gains associated with that. So so that this agreement contemplates all of that, and we're working forward together jointly to say, how do we offer different models to make this more attractive place, not only to keep the doctors that we have here, but to attract more doctors, particularly from around the world.
A question for Dr. Rinaldi. I was talking to a physician this morning who told me just rent over the last 2 years has increased around $2,000 a month. Just quick back of the envelope math, it sounds like at the most it's, I don't know, $3,000–4,000 you guys are giving to a physician per year. So how significant really is this?
So, I mean, if you're going to ask me whether the increase matches the cost of inflation, the increase is about 0.5%. Inflation is 7 to 8%. So it doesn't cover the gap. I will note that all the other health professionals who negotiated with the Alberta government got the same amount, 1%. So no, it's not going to match it, but it is a step in one direction, right? So obviously in negotiations, we would have asked for 10, right? Who knows? But it doesn't cover it, but it is a step in that direction. And I would say, just referencing, will this agreement bring everybody to Alberta? Of course not. There will be a bidding war across the country as each province and territory decides how they're going to try to attract physicians. Anticipated predictable remuneration is certainly one of the characteristics, but it's not the only one. It's being able to work in an environment that is resourced so that you can practice to the best of your ability, so that you're not looking at other things like extended wait times for things, or that we don't do this service in Alberta. Communities that welcome physicians and provide support for those physicians, or perhaps for their families and another working spouse. Lots of things bring people here. So the dollars is not the only thing. But I think every province and territory realizes that if a bidding war is how it's going to lay out, everybody's going to lose, including the public.
And if I can add to that, like the business continuity program, that provides some assistance. We're also increasing, just frame of reference, most doctors are paid on a fee-for-service model. Part of that fee includes, overhead costs associated with that. This is on top of that, and we're also increasing those fees as well. So, and then looking at different models that we can support doctors in doing this. So, but Dr. Rinaldi is quite right. This is an important step, this AMA agreement, to actually provide stability, which gives us the, adds surety about, okay, what are we going to get from a revenue standpoint, which is helpful. But then we're going to continue to work together to address other issues, particularly shortages of doctors. We are, already investing on retention and recruitment issues, $90 million a year. Actually, this agreement, increases some of those programs to be able to do that. And quite frankly, we're going to continue to working together. But that's the one beauty of, I'm very pleased about, working with the AMA on this agreement. This is a partnership. So, just because it isn't in the agreement doesn't mean there's an issue and we can't work together to try to solve it.
I think it's fair to say that the relationship between the AMA and the province has not been optimal at every point over the last few years. Is it fixed now, or do you guys agree to, do you guys have a good working relationship now?
Well, I could start, and Dr. Rinaldi to comment. I would, my focus when I came into this role is that we need to work together because we have so many shared interests in terms of providing care for the Alberta patients. And that's why we embarked, and very thankful to Dr. Warren for agreeing to an interest-based process where we talked about what are our common interests, and then which actually led us eventually to this agreement. And then also, communicate on a regular basis with Dr. Rinaldi, because we have real issues and we need to work together. So, you know, I fully appreciate that. You know, there's some doctors may not, you know, be happy with our government, and I understand that. But we are working together because we know that there's a commonality of interest, that we both have the same interest of serving the Alberta patient and Albertans, and we're working on that. But I'll ask Dr. Rinaldi to respond.
Yeah, I mean, obviously there are issues of trust amongst some members, and some members it will take longer for them to accept that we do have a relationship. Some will never forget this happened. But we would not be moving forward any more successfully having a grudge game and doing nothing. And that would not facilitate patient care. So I think we've chosen the right road. There are issues. We are responsible to care for our patients. How do we do that? We can't do that on our own. We need to work with government to do it.
Okay, thanks for that. Sorry, Francois, we've got a couple of reporters on the phone. Can we go to the phone and try to wrap up? So we'll go to the phone now. We'll take two on the phone, please.
Thank you. The first caller is Janet French, CBC.
Hi there. Hopefully Dr. Rinaldi can hear me. You did mention the strain you were observing on the hospital system. On December 8th, you shared a call from your pediatric section asking the government to take more measures to prevent the increased hospitalization of sick children, including more promotionary vaccination campaigns, school-based vaccine clinics, a temporary mask requirement in schools, among others. How satisfied are you that this provincial government is doing everything it possibly can to reduce the strain on children's hospitals?
All we can do is advise to follow the evidence, right? And the evidence does include things that protect the public. Government will make its own decision how it goes forward. I think in some areas it has done better than other areas, but I certainly don't think they're obstructionists. I think that if we look at just how the world has changed since COVID and how people have come out of COVID, it gets very dicey to start mandating things without having consequences. And perhaps it's better to be positively educating, peer comparison, and asking people simply to do the right common sense thing.
And just to follow up on that, you know, Dr. Rinaldi and I have spoken on that issue. We're also, you know, working to bring together the group of all the parties again to actually talk further in terms of how can we actually support the children's hospitals for this. I had the opportunity last night to spend just under a couple hours at the Stollery, and I just want to take this opportunity to thank all the healthcare workers, the nurses, the doctors who are working there at the Stollery for the tremendous work they're doing. The system is under stress. They've done a remarkable job in terms of expanding, you know, their surge capacity, and we talked about, you know, what not only they've done in terms of expanding the amount of beds and bringing in staff and getting help from the adult side of the U of A, but we also talked about, okay, what do we need to do, like, as we get through this current peak, because, you know, flu is dropping, RSV is still rising, you know, but COVID is dropping. We get through this peak, there will likely be another one this flu season. The season is, we're just into it right now. But, you know, what can we do to support them at that point in time? And you know, Dr. Jaffe has you know, continued to come out, you know, especially on the, you know, talking about, you know, asking Albertans to make the choice to get the flu shots. And we've had some success in that regards. The last couple of weeks of increase of 3.5%, and we're continuing to run campaigns in that regard. So, you know, recognizing our hospital system, particularly our children's hospital system, is under strain, and we're continuing to not only you know, work together to say how do we add capacity in the short term, but also, quite frankly, build capacity over the long term, because we need the surge capacity. You know, budget 2022 additional $600 million to do that, and we're continuing to look at how can we do that more, and also the appointment of Dr. John Cowell to look at these particular issues to improve the flow throughout our whole emergency departments across our entire system, and add capacity so we can respond to these challenges.
Thanks, Minister. Janet, follow-up?
Super quick follow-up, and I was actually going to ask you about your visit to the Alberta Children's Hospital. What did you see or hear there that led you to believe that your government is taking the best possible approach to keeping children healthy and preventing them from that hospital from getting overcrowded and the Stollery?
Yeah, so, the visits both of the children and the stollery was, the conversation of, number one, that they are very busy and the system is under strain. And, my purpose to going there, quite frankly, was to say thank you to the staff for their, tremendous efforts in doing this, and also look at what they were doing in terms of the, how they're building surge capacity. Now, recognizing, incredibly busy, we've seen, the pressures on the Children's Hospital that we haven't seen for some time. Some people told me this is, the amount of pressures that are on the system has been highest that they've ever seen it. So that tells us that we need to have more tools for surge capacity, and be able to manage this, not only to get through the current wave of flu and RSV, but the next one that's coming. And then in addition, urge people to, make the choice to get vaccinated and get their flu shots. And Dr. Jaffe has continued to do that. Was out on Twitter earlier this week, in a follow-up to, the letters that he sent to all parents in terms of how to manage through the RSV and respiratory virus season, as well as the news releases he put out earlier in November.
Thanks, Minister. I think we only had the one reporter on the phone, so we can take one more real quick one in the room, please, and then we need to wrap up. So just single question, please, in the room, whoever's been waiting.
Real quick, when you said there will be a review to modernize the program within 2 years, what does modernize mean?
Yeah, so we're going to take a step back. Look, with the AMA is the purpose of the program, and it's being done on a certain fees. It applies to certain fees only, and it's a top up in regards to the fee for service that we already have. Is this the right model? And actually, does it do the job that it needs to do in terms of looking at, like, in rural areas, right, versus urban areas? Are we getting the right mix to be able to provide supports? Because typically in a rural area, the panel size is smaller, so you actually have less visits that this can apply to. So is it doing enough to be able to do that? So that's the purpose of the review, is actually to look at those and say, do we want to make adjustments to the program? This is one of the large issues for the AMA during discussions in terms of the business costs. So we agreed as part of the agreement that, okay, we're going to do this on the existing program right now, just so we can get it out the door and get the support immediately to family physicians, recognizing that it may not be as optimal as we'd like it to be. So we're going to take some time to look at it. I don't know, Dr. Rinaldi, you're closer to this than I am. Anything to add?
Yeah, no, I think you've described it. I mean, when it was negotiated, it was a way of recognizing, I'm trying to think, that was 2 agreements ago. So costs were absolutely astronomical in places like Calgary and stuff. And we'd started to talk about rural, but we found there were places where it was just impossible to believe that physicians could actually keep a community practice open. And unlike other small businesses, physicians can't raise the price of the fee, right? The office visit, we can't just say my overhead went up 20%, so does my cost. So this was a recognition that way, and we just have to look at, is there a better way of doing it? Many of the things that we institute to solve a short-term problem seem to take on lives of their own, and then all of a sudden an independent assessor comes in and goes, what is that program? You need to reevaluate it. And that's because we haven't ongoing looked at it to say, is it still appropriate? Is there a better way of doing it? So I'm absolutely comfortable with that approach.
Thanks, Dr. Rinaldi. So we'll wrap up there for now, folks. Thanks, Dr. Rinaldi, Minister.
Thank you, Dr. Rinaldi. Thanks, everybody.